The question you posed, can eating a ketogenic diet improve symptoms of serious mental illness? And this included 31 patients. Bipolar, there was 12 of them, major depression, schizophrenia. You describe a ketogenic diet, 75 to 80% fat, 15 to 20% protein, 5% carbohydrates. Symptoms improved in 100% of patients. 43% achieved clinical remission. 96% of patients lost weight, and 64% of patients were discharged on less medication.
With serious chronic mental illnesses. And he's been working with some of these patients for decades. And what I found, I mean, so many remarkable things I find about his work. Uh, the reason why he decided to ask 31 of his patients who had what's called treatment resistant mental illness, the reason why he asked them to come into the hospital and try a ketogenic diet is because they were not responding to all of the different types of ways that he had tried to help them with medications and psychotherapy and support, and even repeated hospitalizations, and in some cases even electroconvulsive therapy or ECT in the past. So he had witnessed a young family member of his and his extended family with epilepsy and autism respond beautifully to a ketogenic diet within just a few weeks of having started it. I wonder if this diet seems to be good for the brain. I wonder if this diet could help my patients. I have nothing left to offer them except my ongoing support. And so these folks who trusted him, they came into the hospital, and they stayed in some cases for very long periods of time. In any case, he put them on a ketogenic diet in the hospital setting. This has never been done before in any kind of a sort of organized or systematic way, and all of them improved. There were 3 people who weren't able to stick with the diet for more than a couple of weeks, and so we didn't analyze that information because they didn't stay on it long enough. But 28 out of 31 did stay on the diet, and everyone improved. And I want to just reiterate what you said: 43% of these patients achieved clinical remission. That you do not see that with conventional psychiatric care, and especially without increasing medications. He put all of the patients on the same diet. And the reason he did that was because he's not a researcher, he's a clinician. He was simply trying to help his patients and seeing what would happen. And we published, this is what it's called, a retrospective study. We published the outcomes after the fact because they were so noteworthy. And we just thought they deserved to be shared. And so that hopefully will help people, inspire people to do more rigorous research, which I think it has done.